Dear audience, it is a particular honor for me to welcome you to the University of Tartu. As you already see from the word welcome, it also means come to Tartu, and that is what I will try to tell you as part of my talk, why it is an interesting journey, one that I took myself from coming from Austria, going to a small country like Estonia, but I've not been the only one to discovering this beautiful and really innovative country in the past years. Also, Barack Obama, during his visit as President of the United States to Estonia, said, maybe I should have come and talked to the Estonians when I planned my big shot website about giving everyone in the United States social security, which was also known as Obamacare, which failed miserably because it was a push-button, big launch project rather than an agile, evolutionary introduction of a new website. And that's something that we can certainly learn about Estonia, how to do IT projects in a sense of making them work for citizens and for the institutions. And that's something I would like to tell you about today. Estonia is a small country. It's a small country, for some you could say at the end of the world. We believe here in Estonia the beginning of a new revolution, a revolution of the datafication of our society, of making ourselves usable or using data in our everyday life. Estonia has put its emphasis on this digital transformation, a digital transformation that has reached almost all parts of society, and even those that are more of animal nature. We could even say that animals are online in Estonia. Okay, that might be a bit far-fetched, but still you will see at the end of my talk that there is nearly nothing else that has been left untouched. Estonia has gained itself a reputation of being a digital republic, of being a country that has built a digital society, one that actually can be transformed elsewhere as well, and where it is the first digital government, where it's the first country that has introduced an e-residency, one that actually has transformed from a maybe second league nation to a first leading IT nation. So even so far that it is said that the Chancellor of Germany has put up a saving pig in its administration, and whenever you mention Estonia in the context of digitization, you have to put a euro in there because it has been mentioned so often. So it can also be almost like symbolic for digitization, which in some sense is certainly the narrative and the image that Estonia is portraying to the world. But let's have a look at what are the different elements to look into. In Estonia, we can consider that everybody or every institution has an internet access. You could maybe think that that is only just a very slow dial-up connection. No, it is actually broadband that is generally available throughout the whole country, whether that is fiber or mobile phone connections. 75% of the households have actually broadband access, if not even more by now. All bank transactions actually take place digitally. Okay, that doesn't sound that surprising because it also takes place that way in most other countries. But what is surprising is that those transactions actually take place instantaneously. So when you do a bank transfer in Estonia, it arrives on the bank account the next second and not a day later like in most other countries, or even longer when you do transactions abroad. You can even see this adoption level that people are actually using digital tools in Estonia with one number. Last year, during the tax return period, which always takes place at the beginning of the year, 25% of the population returned their tax returns within 24 hours. So 1/4 in one day. That is how easy it is in large parts to use Estonian e-government. And that also is reflected with the use of electronic signatures. Electronic signatures are the digital representative for handwritten signatures on paper. They have almost the same legal effect, only in the area of personal relationships, meaning marriage, or when you buy a property, you can actually use electronic signatures. That is not only the case in Estonia, it is actually the case in the whole of the European Union. But what is different is that Estonians really use it. So it's not a theoretical possibility, but it's an actual possibility. So there are 1.4 million ID cards in the country. There have been given over 1 billion electronic identifications and 1.1 billion digital signatures, it's tremendous numbers. So we can say that the use of digital signatures and many other digital tools is diffused in Estonia, so meaning the general population is able to use them, and that's the big difference. So when we want to take this next step, so meaning not only having digital tools, but actually having the availability and the usage of data, basically let's first start with what do we actually want to do, or what do we need to do with data. For that we need to understand what we can do with it. So data actually is a representation of properties of an object, of things that we see in our environment. So it's actually kind of like raw representations. Out of that, we actually need to make sense of that data, and that is when we actually generate information so that it actually means something to us. And when we actually can derive from the information something that we can do with it, something that we can actually transform that information with, then this is what we would consider knowledge. And when we are actually able to add value to this knowledge, then we can call that wisdom, right? And this pyramid is really helping us to understand how do we get from this, let's call it sea of data, to what actually adds value for our life, meaning wisdom of improving. And that's actually the idea that we want to do with data in Estonia. So it's about data and its use in the government, so meaning for our society. So we want to use it for setting strategies, we want to use it to evaluate progress, we want to use it as a tool for policy design, or also as a source of power within bureaucracies. We want to monitor what's happening and how the performance is actually taking place and how to improve it. So it actually allows us to really get a good, full understanding of how our government works, how our society works. It's not something to actually decide automatically on what things are happening, but it actually should inform us on how to take the decisions, sometimes even proposing the decisions to us through sophisticated algorithms. And that is actually what we're going to study here in Estonia and also at the University of Tartu, where you can also study that. So we can understand everything in our life as a data problem, meaning that social problems are data problems where we need to have more information. Let's take, for example, the COVID crisis. We need to know who is infected, how do the infections spread, where do we need to take precautions. So you can consider that already as a first element where we need to get the necessary data, how to put it together, how to process it. So what we actually want to do with the data is actually to have a more effective and efficient intervention on the basis of that. So basically being able to improve our life. So it is actually the ability to handle data is a more universal problem that cuts across various domains, labor market, social policy, and also healthcare, which I'm also going to tell you a bit more about. So we are trying to understand how can we assess the impact of IT on our life. So we want to understand how does the usage of something transform the way that we're doing it, and how can we actually even further improve it. So we can look at what are the costs of a new initiative, what are the complexities that come with it, and also how to actually increase the convenience for the users. And one of those areas is actually the area of electronic voting, where Estonia is the only country in the world that is running or provides the possibility to all its eligible voters to participate using the internet. Some may say that's a very risky business. So far it has worked out quite well for Estonia, and it actually has addressed a numerous number of criticisms and areas for improvement on how to actually make this a safe and state-of-the-art way of participating in the election. And we want to see what can we learn from it. So in order to do that, we want to use the data to build small, fast solutions that actually work, to actually build an ecosystem that is making use of data, that actually is allowing us to build small snippets of improvements all around the country. So we need to think about how can we actually build applications that make use and cross-use of data that we can generate from other processes. On the upside, we can actually be very fast and agile with that. On the downside, we actually introduce dependencies between different domains by using the data across the different domains, and that might also create data protection issues where we need to be very careful about. So I want to give you one of the examples of what we have done so far with the data. We have actually collaborated as a Center for IT Impact Studies here at the University of Tartu with the Estonian Unemployment Insurance Fund and the Estonian company Nortal, and we were actually selected as the best data-driven digital service just recently. So we actually provide a decision support tool that calculates the employment probabilities for an unemployed and suggests help based on that. It's not taking the decision by itself, but it provides opportunities and assists the decision maker on this. And the score that is being aggregated from the tool can be used for different purposes on other levels, on client portfolio management, on bureau risk profile management, and of course also on a country level labor market monitoring and providing input to policies. So having just a small tool that is using various data sources that are publicly available, it actually helps to provide feedback on the one hand side to the individual, but also to the labor market in general. And that's one of the ways how we can make use of data. But what do you need for that? And that is in particular the unique set that we have here in Estonia. You need to be able to integrate different data sources. And here Estonia is in a unique situation. And before I go into that, maybe let's go back to Lane and Lee's prediction that they took in 2001. This is one of the most eminent papers in the area of e-government, where they actually proposed a stage model that basically the development of e-government goes in 4 separate stages, where first a catalog would be provided, then transaction service would be available, and then first a vertical integration, meaning between different levels of government. First, municipalities with regions, regions with the federal government would start to collaborate within one domain. And then a horizontal integration would take place, so basically it will go across different domains. And that is where actually most countries are lagging behind. They're actually not starting with the integration. They maybe have already some transactional services, but they're not having this integrational efforts available. And that is where Estonia is different, as I mentioned before. It actually has an integration layer, a data exchange layer that allows for integration of various different data sources, but not preventing the data sharing, but actually providing accountability to the data subject, meaning the citizen. So you can see whenever you want, how has your data been used, who has access to data, and ideally also for which reason. And that is providing a new way of how we can see data protection, because it provides actually transparency and actually possibility to do something about it when your data is being used and you're not that dependent on a big power to tell you, okay, how your data was actually used, and you will never find out actually if something happened with it that you didn't want to do. So let me come to this area of e-health, because I think that's one that is concerning us the most these days when we're thinking of how can we actually overcome this problem of having to live at distance, of having to self-isolate and still being able to access government services. And here, e-health in Estonia has already taken a giant leap forward. So already 5 years ago, 740,000 data sets were available about the patients. More than 20 million of data acts actually took place in the system. More than 300 million events were recorded in the system already back then. Even 50% of the referrals, and even more today, were done digitally, meaning that's when a doctor actually transfers you to another specialist, and that was already available in the system. And all of these events are time-stamped and fingerprinted, meaning you cannot change what you have done in the system. So it's actually being documented on how your data is being used and actually enabled. And that's where the data protection again comes in. So as part of this e-health ecosystem, e-prescription probably is the one that is most evident, because it's the easiest to implement for many other countries, where actually several countries are following suit, in particular during the time of COVID. And Estonia has done that already some time ago, and actually managed to have quite a jump from actually using paper prescriptions to using digital prescriptions in only a very few months. How did they manage that? By actually accepting that there will be mistakes. So they basically explained publicly, e-prescription will not work perfectly, but the one thing we promise, within 24 hours we will know why it didn't work. So when in the beginning it was only every 4 out of 5 prescriptions were working digitally. Within 5 months they got up to a success rate of almost 100%, and that's how you might say it was banana software. It was actually ripening at the user, but had that been fully tested, it would have taken a year or 2, so it was possible to deliver it to the market much faster. So obviously there is a different approach to innovation than in most other countries. So it is acceptable to actually being involved to, so to speak, co-create the solution by providing your feedback and accepting also it might not run perfectly, but over time you're actually able to solve it together. So the core of this is actually the DigiLugo portal, which is the patient portal that is, so to speak, the face of eHealth to the citizen. You can log in using your digital signature infrastructure, be that your eID, your mobile ID, which works on your mobile phone, or other forms of identification like an app. In that portal, you actually see your health data. You can access every single case. So when you visited your family doctor, when you were referred to the hospital, even you might see some x-ray pictures. Actually, when I broke my toe, I thought this x-ray picture would be in the system, but it wasn't. It was obviously not important enough. Yeah, I mean, let's not go about the story about breaking a toe, but that's my personal fate in there. But it worked, yeah? So everything is fine now, I can assure you. So you can also, what I want to show you today is actually an integration of this cross-domain integration that we have here in Estonia. So in Estonia, you need to show that you are healthy and fit to drive a car. So when you have to renew your driver license, you need to have a health declaration that is signed by your family doctor, and that is then being transferred, meaning only you're fit to drive a car is transferred from the eHealth system to the driving issuing application. So first you fill out a questionnaire, so make a health declaration. You actually then go to your doctor that actually confirms that, and then you go to the driver's license portal or the portal of the transport authority and actually apply for your driver's license, and there you log in using your eID card, and it will say, yeah, hello Mr. Krimmer, what do you want to do? You want to renew your license. You can see there your car. You want to renew your license, and then it asks you, so do you have your medical certificate? And you say, yes, I have already been provided with it, and then you can submit your integrated application for your driver's license. So what is possible is actually really this cross-domain use, but that's not where it gets interesting. I mean, that's, I would say, almost like the one-on-ones of your government. Where it gets interesting is actually how we can use that data of such a patient portal, meaning by we, I mean, of course, the authorized authorities that are actually allowed to do that. But it allows actually to provide personalized medicine. That is certainly not available yet fully here in Estonia, but it's something where you can easily enhance traditional healthcare systems and to actually upgrade them. On the one hand side, you can make automated fraud detection. You can actually have an analysis of the treatment effectiveness, if actually a specific treatment was helping the patient to get healthy quicker, or maybe it could be changed a bit, or the doses could be changed. So it actually allows to get more monitoring here. Would also see on a population level a side effect of a medication. It would also allow for this, of course, with the necessary anonymization in the portal so that you don't infringe on any data protection rights. One of the things that we could actually also see, for example, in terms of cost savings, that the e-prescription system has allowed to bring more transparency into the Estonian use of medicines, or also which medications are being used, leading to a 25% decrease in costs, because actually generica could be used instead of the original medication with having actually the same effect. So you wouldn't go for the brand name of the medication, but you actually would go for the best treatment for the patient. And so here, really having simple user interfaces and supporting the person that is filling out the prescription can lead to significant improvements for the overall system without any side effects for the end user, being the patient. We could also say with the e-prescription, it actually also enhances the comfort. Yeah, so between Estonia and Finland, since almost a year, you can actually go to the neighboring country. Okay, if COVID allows, of course, we know that problem. But basically, when you go there and you have a regular prescription that you need, but you forgot about getting it right before, you can call up your family doctor. They give you the prescription in the digital system, and you can go to any pharmacy in Finland or in Croatia to pick your medication up, and vice versa. Actually, for Finnish prescriptions, you can also pick them up in Estonia. So we actually see that there is a whole new digital single market evolving, not only for actual business domain, but actually also for the health domain, that we as a citizen can actually roam around Europe as soon as we have overcome COVID, obviously, and we can travel more easily than today. Then actually those elements of data integration, of data ecosystems will help us do that. So let me come back to this idea of personalized medicine. So at our university, we actually have the Estonian Genome Center. So it's one of the largest databases of genome data of a population in the world, with more than 10% of the Estonian population having sequenced their genome data as part of the Genome Center here in Estonia. And that actually allows, on the one hand side, to predict what illnesses will appear on a population level, but it will also allow on a personalized level to indicate to a patient what kind of illness he might be endangered to develop over time. And how did Estonia manage that? It actually, on the one hand side, had a PR domain of bringing in citizens to that genome database, and I was actually quite surprised to see public advertisement for that. In my home country, that would have probably been a bit of a problem, but in Estonia there, I would say the population is much more open for discussing this and also seeing the benefits that such a genome database actually has. And it actually provided lifestyle-based advice to the patients that got their genome data sequenced, and also it allowed to identify 13 people that would have been endangered of having an early heart attack, and actually highlighting for them for a lifestyle change and helping them to actually overcome that problem. So let me try to summarize what can actually such an integrated approach to data, to digital, and actually also healthcare bring. It allows actually to better manage healthcare in the country. It will actually allow to have simple interventions, meaning small snippets, small applications that can be used, and will actually help us to use the GDP, the money that is available to the public, more wisely and actually for the better good of the citizens. It also allows to simply manage better, to use the available resources in a better way. It allows on the one hand side fraud detection, to minimize side effects and actually bring the good for the citizens forward. What you need for that is really having this understanding that data is something very, very valuable, but only if you're able to use it. We're not talking about personalized data, we're talking about generally available data about the country, meaning allowing for automated analysis using artificial intelligence, which in the end is about machine learning and actually identification of optimizations and minimizations in there. You also need to be able to cross-use building blocks in the code base. So actually you shouldn't have to redevelop everything from scratch. And it allows to use data, and ideally in the form of application programming interfaces, meaning automated access to databases and not actually having only data dumps that are lying around, but actually allow for better integration. And then last but not least, actually having this ecosystems that actually enable this integrated digital approach. That's the key element. I would say that is one of the reasons why I, as a researcher, came to Estonia, because I wanted to be able to shape such a digital ecosystem with my knowledge, with my ability to collaborate with colleagues and actually learn so much what we can also generalize and use in other countries as well when we consider the necessary context. And with that, come to Tartu, come to work with us, study with us, and do research. Thank you so much.